And it was Paulina Butska reporting. When the pandemic hit, it forced many businesses here in southern Nevada and across the country to close. Even as essential workers, many doctors' offices were also affected. Well, all this week in our Health Check 22 series, we're looking at some of this year's biggest impacts on our health. And tonight, anchor Dave Courvoisier has the effort to get patients back in the exam room.
I had candid, difficult discussions with patients, family members, right, to say, hey, this is not one at this time that we can provide you care for.
Dr. Saju Joseph says the pandemic is like nothing he's ever experienced. In the early months, the surgical oncologist was limited from doing everything possible.
Screening, from colonoscopies, mammograms, all those things were really kind of shut down.
Did people die or have too much advancement in their problem because of this?
Absolutely, 100%. I will tell you, the thing that probably scarred me the most was the people who passed away who couldn't see their loved ones.
But even as the healthcare industry eased restrictions, other issues slowed the process.
You had not only the patients that were established, you had new patients coming, and you then had the third crunch, which was providers leaving.
Dr. Joseph says many doctors were quitting, retiring, or moving to non-clinical jobs. Dr. Christopher Mercado, Chief Medical Officer with Dignity Health Medical Group of Nevada, was among the many doctors taking on new patients.
In Nevada, we're 48th in the nation in terms of doctors per capita. So we are not only on a backlog of patients who need to be seen from the pandemic, but also at a backlog of patients who need to have a primary care doctor, but we just don't have enough doctors to see them.
Dr. Mercado says his office and others are getting patients back on track with the help of nurse practitioners and telehealth. But he says there's still a lag for some medical specialists.
Maybe it would take 7 to 10 days for an ultrasound. Now, because there's so many people here who need imaging, whether or not that's chest x-rays, mammograms, that can take 4 to 6 weeks to get that done.
Dr. Mercado says those delays are taking a psychological toll on patients.
I think that's really what we're dealing with now on the primary care setting, is how the waits in terms of like imaging or elective procedures are starting to affect patients.
Dr. Joseph agrees with the prognosis.
Best example here, if you need to be seen by a rheumatologist, it's a 3-4 month wait, and we're hustling to get these people in, and these aren't diseases that can just sit at home, waiting.
For those who can wait, Dr. Joseph says the good news is a lot of patients are getting the help they need outside the hospital.
I would have told you 2 years ago, pre-pandemic, probably a good 80-90% of what I did was in the hospital. And now I tell you probably 50-50. We can provide pain control, fluids, and care for you in an outpatient setting.
But there's one more major hurdle facing many doctors, reaching those patients who have completely stopped seeing any doctor during the pandemic.
Still trying to get out to the community and say, right, if you need something, right, if you need to be screened or you just need to be seen, we're here. We are putting patients in everywhere we can fit them. We are gonna, if we get somebody referred over, we're gonna fit them in as quickly as we can.
Dr. Mercado is prescribing the same advice and says everyone should be getting back into the habit of seeing their doctor regularly.
Really important for us to catch things early, get patients in for the annual visits, and have blood work done to make sure we're taking care of them ahead of time.
Dave Courvoisier, 13 Action News.
And this story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.